As usual, another great guest, but a quick diversion. You'll notice that our full name is the Marketplace for Health, Wealth, and Freedom. Well, let's talk about your health for a moment. If you'd like to escape from the stranglehold of insurance and be able to see alternative doctors or go across state lines for care, then you definitely need to take a look at patientempowerment.mpb.health and see if that's the fix you've been looking for. Now, let's get back to the show.
Hello, folks. Charlie Froman here. Welcome to another week of Freedom Hub's Health, Business, and Politics weekly webinar. Jim Graypeck is my steady co-host. As folks will get to know him, he is the entrepreneur behind Pavilion, which will give us the next stage of primary care with a lot more integrated options, because with the chronic disease epidemic hitting half the population, people aren't going to just accept the status quo allopathy, and people are educating themselves regardless of what the government wants them to do on how to cure their chronic diseases. And this is an exciting episode for me because I was there in the beginning with health savings accounts, as was Roy. Roy was a bit higher than me at the Senate Finance Committee in the early 90s. I was a lowly Republican staffer for a Pennsylvania Republican, and this is a pretty big deal. So folks know Hillary tried to, in the words of my later colleague at Cato, Doug Bandow, this is the best description of Hillary care I've ever heard: shove everyone into an HMO and then cap the budget with Medicare price controls. A neat, easy fix. Just pay off the HMOs to control it. And we weren't enthralled with that idea at all. And a group of people, including an insurance company owner, Pat Rooney at Golden Rule Insurance Company, Jack Strayer, former chief of staff for Reagan's OMB director, David Stockman, when he was a Michigan congressman, Jack Strayer, Greg Scanlon at Cato, John Goodman, especially at National Center for Policy Analysis, were saying, get folks instead to self-insure for the out-of-pocket at higher and higher amounts, and give tax advantages to an account to help them pay cash. And that, over the past decades, has become a panacea, not only to empower patients and families with the cash for the out-of-pocket as these insurance deductibles get higher, but also just to get patients shopping on price, which we all know has to happen. It's so hard. The opacity of the system is really discouraging. But unfortunately, a lot of blue-collar workers especially haven't been funding these HSA accounts appropriately. The CEOs haven't bought into the dynamic of HSAs enough to fund them for the workers. A lot of these Rosetta type brokers are poo-pooing HSAs because of that dynamic, leaving folks bankrupt and owing a lot of medical debt. But it's not the fault of the HSA, it's the fault of the advisors, my fellow health insurance agents, who aren't sufficiently educating the businesses about the power of the HSA. Executives understand it's a great tax shelter to build $100 grand for retirement. When you really get sucked by out of helping initial savings account path and a professional in the, and he's now a consultant services to give us the skinny, show us some slides to help us join the cause. Cato has a big, large HSA campaign. If you want real health reform, you have to empower patients and help doctors offer appointments for cash pricing. You can't fix a market without rationing. So take it away, Roy.
Well, thank you so much. I'm going to draw that circle even tighter for you. David Stockman went to my high school and was my congressman. And I did meet Jack along the way. He grew up in a town about 10 miles from me. So yeah, it's amazing how all those connections go back. So I am Roy Ramthun and delighted to be here. I'm going to share with you a lot of information that's publicly available, but I led the implementation of the HSA program back after they were created in 2003, and have really devoted the latter part of my career to HSAs and helping people understand them. Some new data that you may not have seen, since we've been asked the question so many times, as how many people are covered by an HSA. And in 2020, Devenir, actually this is a 2021 report that Devenir did based on 2020 data, suggesting that there's over 63 million people that are covered by the 30 million HSAs as of the end of 2020, which
Roy,
is about a third of all
excuse me, Roy,
privately
do you want
insured
to share your
Americans.
screen? I'm sorry, were you going to share your screen?
I'm sorry, I thought I was doing that. Did you take it back?
Yes, go ahead.
All right, just a second. All right, can you see that again?
Yep.
Okay. So as I was saying, about a third of privately insured Americans, we think, are covered by health savings accounts and the qualified insurance in about over 30 million accounts. This report also included some data for the first time on a state-by-state basis. So this map shows you the estimated number of HSAs by state, so you can see where they are and where they're not. This map shows the estimated people covered by an HSA. So this is how the 63 million breaks down across each state. And you can see, Texas leading the pack there, not surprising with Dr. Goodman being based in Texas. And then looking at that statistic of approximately 1/3 of all privately insured individuals covered by an HSA. And here, the state of Utah leading the pack with really double that average of about a third, where you have 77% of people in Utah participating in an HSA, going all the way down to like Hawaii, where it's, around 2%. So again, this report is publicly available. I'll make sure that you know where to find that. But if you go to devenir.com, you will be able to find this report. Their most recent report, which came out last week, gives us the updated figures on the number of accounts and the assets in those accounts as of the end of 2021. So you can see that we are now over 32 million accounts. And surprisingly, the 30-year-olds are the greatest adopters of HSAs, which I think is great for the future. Because if these are the folks who have HSAs in their younger years, they're more likely to keep them as they age and understand that growth potential, certainly through investment. They are overrepresented relative to their share of the population. You can see that folks in their 30s are only about 12 to 15% of the total population, but they are well over 40% in terms of representation of HSA account owners. On the asset side, we just passed the $100 billion threshold as of January of this year. And Devenir projects that that's going to grow to $150 billion in total assets by the end of 2024. You can see in the green portion of the bar, those assets that are being invested, which are the fastest growing piece of the deposits, thanks in part to growth in the market. But still on average, only about 7% of HSA account owners are investing. So we have some headroom there. A couple other demographic things, it's their HSAs are about evenly split between those that have families and those that do not. About a quarter of all the dollars contributed to HSAs come from employers. Around 60% are coming from employees, and another 11% or so are coming from individuals that are not associated with an employer, either self-employed or covered through individual market insurance and making contributions that they're deducting on their income tax return by themselves. Not surprisingly, those who've had HSAs longer and those who are older and may have been participating in HSAs and are nearing retirement have the highest average balances. Those who've had HSAs since way back in the early days have the highest balances, which I like to see because this tells me that people understand that these are in fact savings accounts, not spending accounts. And those that save tend to be more likely to invest, which also helps drive their average balance up over years. When we look just at the investor balances, again, those that have invested back in the early days have the highest average balances. We know that there are people that have six-figure balances in their HSAs, especially those that may have started back in the first days with Archer MSAs in 1997. So those are helping bring the averages up. Others, still are getting used to the concept of HSAs and thinking about it as part of their retirement strategy, which we are still encouraging and working with financial advisors to help educate employees and even the employers about this opportunity and how to take advantage of it. Here's a slide showing the leading HSA providers. These providers hold over 80% of the assets in HSAs today. And there are some familiar names, but there also may be some unfamiliar names to you all. So this is somewhat of a niche product in the financial services industry. But some well-known players in there as well. The top three are Optum Bank, Health Equity, and HSA Bank as far as accounts and assets go. Optum is a division of United Healthcare. Health Equity has grown fairly fast through mergers and acquisitions. And HSA Bank used to be MSA Bank, one of the first banks offering Archer MSAs, is still around and doing well. A reminder, here are the contribution limits for 2022. In a couple weeks, I will be announcing my projections for the 2023 contribution limits, as well as the minimum deductibles for HSA qualified plans. And with the higher rates of inflation that we're seeing, these numbers are going to pop like we've never seen before. Typically, they're going up only like $50 to $100 a year. I'm projecting that it's going to be much larger than that in any times that we've seen since the beginning of the program. So look for that information to come out. For me, in a couple of weeks, the IRS will publish it either later in April or May, and I've never been wrong yet. So why I think investing is so important in the HSA is because healthcare costs in retirement are only going up. Certainly before COVID, people were living longer, and that trend will probably resume once we get through the worst of COVID, which hopefully we are. Uh, Current projections are that couples retiring this year are going to need around $300,000. Well, that's going to be a lot more for those who are 20 years away from that. So they need to hear the message about starting to save now. Unfortunately, most people think that Medicare is going to cover all those healthcare expenses. And the reality is it's only going to cover about 60%. So there's a lot of remaining costs that the HSA could be most helpful in saving for. And the sooner you start, the more prepared that you're going to be. On this slide, I list all the different types of expenses that people could pay tax-free with their HSA. A lot of these are not covered by Medicare, and that's where part of the assumption about what Medicare covers and how much of those costs go off the rails. So, I don't think it's hard to understand these expenses, but most people don't realize that Medicare doesn't cover them, and they're not thinking about how much those are going to add up to in their retirement years. If you're one of the lucky people who don't need that much because you're very healthy relative to your peers, when you turn 65, you can use the money for other expenses without any penalty. You are going to pay income tax on those withdrawals, but at that point, your HSA is no worse than having put the same amount of money into an IRA or 401k. So you really don't have anything to lose by putting money in the HSA, either instead of or in addition to your other retirement plans. With your life expectancy unknown or uncertain for many people, you do though need to factor in the risk of potentially needing long-term care. And if you can believe the statistics that are being published about this, people turning 65 today have a 70% chance of needing some kind of long-term care sometime in the rest of their lives. And 20% of them are going to need it for more than 5 years. So that can include care in your home. It could include assisted living or nursing home care. And speaking of nursing home care, it is expensive. If you want a private room in a nursing home, the statistics are pretty dramatic to easily get you to $100,000 per year to have private nursing home coverage. So, when I look at what's coming in retirement, there's really no reason to have to worry about overfunding your HSA. I strongly recommend that people put in the maximum that they can while they can, because once you enroll in Medicare, you're not going to be able to add any more money. But, you could at least use the money to pay for your Medicare premiums and copays. And probably the high likelihood you're going to need it for long-term care as well. And if you're really lucky and don't need it for all of those healthcare expenses, which you can pay for tax-free through the HSA, you can also use it for living expenses. You're just going to pay income tax like you would on your withdrawals from your either 401k or other retirement plan without any required minimum distributions like those other programs have. So with that as a backdrop, where do HSAs go from here? So in the remaining slides that I have, I'm just going to summarize some of the ideas that have been put forth through members of Congress and others on how we might change the rules so that more people can have an HSA, such as allowing people who are enrolled in Medicare to participate in an HSA. Certainly those who may still be working and have HSA qualified coverage that they would like to keep and like to accept HSA contributions from their employer. I've never quite understood why you have to disenroll from your HSA plan to go on to Medicare. But that's how the rules work. And, a lot of us would like to change that. Medicare does have a similar option called a Medicare medical savings account. It was created in 1997, but really hasn't taken off like we would like it to. So that would be an alternative that we could all work on. Other people who have coverage through TRICARE, the Veterans Administration benefits, Indian Health Service, may have a relationship with their primary care physician known as a direct primary care arrangement, or enrolled in a healthcare sharing ministry. Many of those people cannot have an HSA. And so, some of these could be easy, sympathetic groups that we might be able to convince Congress to change the rules, one by one, which, would be the slow way to do this. We could also look at, allowing individuals who today are considered tax dependents to have their own HSAs, or allow people who have HSAs to contribute to HSAs on behalf of those individuals. Another option is to look at how to make the current high deductible health plan, which is required in order to have a health savings account, more attractive. And I certainly would love to get rid of the technical name high deductible health plan, because anytime I've seen a broker start with that in their presentation to employees about their new coverage options, people start to roll their eyes and head for the exits. It used to be that there weren't very many high deductible health plans, but in today's environment, it seems like almost everything has a high deductible. So I would prefer to switch to the term HSA qualified plan. So I know that the plan I'm looking at actually makes me eligible for an HSA. It's hard to figure that out today because so many of these plans look similar. Some things have already been done, such as making first dollar coverage for telehealth services and virtual care services. That was done for COVID. That has been extended temporarily through the end of this year. But others would like to add some primary care visits to be covered below the deductible each year. Others have suggested that we ought to be expanding the definition of preventive care, which is the one class of services that can be provided before you meet your deductible. HSAs were the pioneers in this, and that was adopted later in the Affordable Care Act and is now required of all health plans. In 2019, the Internal Revenue Service expanded its definition of preventive care to include some services for people with chronic conditions to help maintain their health and not end up with worse conditions by ignoring their health, such as insulin and blood sugar meters for people with diabetes and other chronic conditions such as heart disease and I'm just blanking on some of the other ones, but I can provide that more detail if needed. There are many of us who are pushing well beyond these sort of individual one-off changes to just allow more health insurance plans to be paired with HSAs. And there are various ways to do that. I think ultimately, many of us would love an HSA to work with any type of health insurance plan. That may not be politically realistic in the current environment, but perhaps we could look at some things that would get us along that pathway such as using the concept of minimum essential coverage, which is a term of art under what is required through the Affordable Care Act, or perhaps using a standard known as actuarial value, where if you look at the insurance exchanges in the states and you're familiar with, gold, silver, and bronze plans, each of those have a specific actuarial value tied to that metal tier. Whereas, a gold plan is designed to cover on average about 80% of the healthcare costs under those policies. Well, maybe we could just deem every policy that has an actuarial value below 80% as eligible for health savings account. So there's a variety of different ways of doing this. I just put some of the options that are currently being discussed on this slide. There have been recent changes to what HSAs can pay for tax-free with the funds that have been accumulated in your account, such as over-the-counter drugs, which no longer require a physician's prescription. That was added under the Affordable Care Act. It has now been removed. Women can pay for feminine hygiene products and menstrual care products with their HSAs on a tax-free basis. And important during COVID time, paying for personal protective equipment and at-home COVID tests. Those are all tax-free expenses from HSAs. Other things that have been included in bills that have been introduced in the current Congress that people would like to expand HSA's ability to pay for on a tax-free basis. That would include telehealth. I mentioned the need to extend that permanently. We have the short-term fix, which starts on April 1st and runs through the end of the year. Obviously, being able to pay for your direct primary care arrangement would be desirable by many people. Fitness and exercise equipment to help keep you healthy, as well as nutritional and dietary supplements. And then we have Democrats' primary favorite expense is diapers and other related personal expenses. Whether or not there's a medical need or not, they would like to include those things. We see states, going down the path of trying to exempt the cost of insulin and diapers and over-the-counter medicines from state sales taxes. But if you do it through your HSA, you're already avoiding a lot of those taxes anyway. And finally, insurance premiums, which today HSAs can only do on a more limited basis. Some other things people have suggested, it'd be nice to allow both spouses to make their catch-up contributions to the same account rather than having to open two accounts as is currently required. There are no federal bankruptcy protections for the assets in HSAs. Those assets are protected if they're in an IRA, which was created back in 2005, but for whatever reason, HSAs were not included in that law. And we only have about 10 states that have provided any kind of state bankruptcy protection. So that would be something that we'd like to see across the board. Obviously, raising the contribution limits through a variety of methods, either increasing the base amount or the catch-up contributions, as well as allowing people to start their catch-up contributions as early as age 50 instead of 55. Not sure why that didn't match up with IRAs and 401ks, but I suspect when HSAs were created, there was some budgetary cost that was the reason that they got left behind. just so that you're aware, there has been some activity going on related to HSAs in the states. And I've been spending a lot of my time monitoring the state legislation to make sure that states don't negatively impact the state-regulated HSA qualified plans in the small group and individual markets, as well as their health insurance exchanges. There have been some bills where some unintended consequences have popped up, but as from what I can see and tell, it doesn't seem that any state is trying to harm HSAs, and that includes some solidly blue states like California and some of the states in the Northeast. They've been actually quite good about helping protect HSAs and their availability in their states. So I'm pleased to be able to report that. It does take some time, though, to educate all of these people kind of state by state. I'm working with state legislators, state regulators, the trade associations for all of those folks at the national level as well, to help us try to get that information out, either through model acts, model laws, model bulletins, et cetera. But it takes a lot of work to do that. Ultimately, I'm hopeful that we can get kind of an across the board exemption from any of these state mandates, as we see bills introduced that kind of could pile up the mandates. After you say, well, do you want to carve out HSAs for the following 15 or 20 bills? Or would you rather pass a law that creates a one and done approach where you fix that problem going forward for HSAs, so you don't have to constantly come back and include that? Arkansas is actually the leader of the pack here. They passed such a bill last year, and I'm pleased to report that they are the model for the rest of the country. And most people wouldn't have thought of Arkansas being the model, but I'm pleased to announce that they are. And Utah recently enacted a similar bill that would provide that same type of protection in that state. So I think we're on the right path, and we've got some momentum that's building behind us. I guess here for the last little bit, there still is confusion between HSAs and the other healthcare accounts that are based with employers. I still wish people were saving more than they're spending. There's a lot of spending account going on. And I think because people don't understand, how HSAs completely work, they're spending too much and not contributing enough. And so if we can get that changed in their mind, then I think more people will also look at investing their funds as one of their options for saving. I see reports suggesting that there's uneven participation in HSAs between men and women and across different socioeconomic groups, so that we want to make sure that HSAs can appeal to as many people as possible, and that an employer, understands where there may be challenges within their workforce, and understand the opportunities that they have to help those individuals who may be seeing the high deductible and not being able to afford that on their own. There are plenty of ways that an employer can help do that. I do also think about, will there at some point be some kind of event that encourages employers to look at, dropping their group health plans and or moving, in the direction of a defined contribution approach. I want to make sure that there's a robust marketplace for those individuals to actually buy coverage if for whatever reason it's no longer available through their employer. But we've got to make sure that everybody understands these dynamics and help educate people so that they understand what the options are and how to take advantage of them. So, a lot of other health plans look similar to HSAs today. That creates more confusion. The premiums are now similar because they have raised their deductibles to be up there competing with the HSA plans. We have a technical issue with the Affordable Care Act, who again borrowed that concept from HSAs of putting an annual limit on out-of-pocket expenses, but their limits are several $1,000s higher than HSAs, and that's creating challenges in being able to offer HSAs within the construct of the Affordable Care Act. A lot of people don't use the preventive care that's available to them. It's free, and they're not understanding that that is an opportunity for them to save money. Again, the confusion between the different types of healthcare accounts that are available. Now the new tool that employers have to use individual coverage, HRAs, to provide a funding mechanism for HSA qualified plans that are individually owned and then reimbursed through the employer. And, also to make sure that we're keeping on top of the state benefit mandates that could create problems down the road. So, I think HSAs will continue to grow. I think we've done a great job of getting them into the fabric of health insurance. But obviously there's ways that they can be improved. And so the more people understand the opportunity that HSAs offer, the more that we're going to be successful at expanding them in the future. So I would be happy to take the rest of the time answering questions. And for those that want to reach out to me later, this is my contact information.
Well, thanks very much, Roy. That was fantastic. You hit the nail on the head. It's a powerful vehicle, but not quite appreciated enough, especially by the employers, to get the folks to utilize them appropriately, especially with the savings and investment side over the spending side. And if I could share my screen with a couple questions I have. Have you heard of the health matching account that now is taking the agent's market by storm for out-of-pocket expenses?
I have heard of it, yes.
And have you looked into it at all yet, or is that
I
maybe
haven't. I haven't.
Okay, because I sell HSAs and HMAs at the same time to fix that problem of folks spending down their HSA accounts. If they can use the HSA as a tax shelter to build that 100 grand for retirement, then you can see in this column here, spend 40 or 84 bucks a month to double that money for your current out of pocket. And I'll put that link in chat because this is not a show about HMAs, but they match nicely the HSA, allowing the HSA to grow because you don't want to overspend them. On the bills, I'm also the lobbyist for the oldest health freedom organization in the world, NHF, and I'll put this in link in chat. We have a campaign to get a couple of those bills passed. One, to allow supplement withdrawals from HSAs. Through COVID, they allowed OTC, over-the-counter medicine, tax-free withdrawals, but not preventive care supplements. And people should be hearing about the deficiency most folks have for vitamin D. And also in our campaign, Roy, I've put Senator Paul's bill, which we all know would allow for huge increases in what you can contribute to HSAs. because we believe, like you do, and most folks do, that you got to let HSA stand alone. You have to really allow a lot more contributions, a lot more, a broader withdrawal universe for what they can be used for, to help them get more utilized appropriately. And finally, Roy, Rick Willard, who's a National Federation of Independent Business advocates, is an agent well known in the HSA community as an early adopter of HSAs. And he's going to comment on what you said in terms of his sales on the ground with small businesses. I'm showing here, and I'll put this in the link. This is his landing page. And for folks who want to get an HSA, and the link will be in the chat, for as little as $275 a month, you could upgrade from insurance to sharing for major medical. And this comes with a MEC that Roy mentioned, a minimal essential coverage piece, with the appropriate deductible that qualifies this option for the HSA. You do have to be self-employed to get this, or in a small business but below 50 people. With the list bill is really easy. So the prices are good, and you get your major medical through sharing instead of insurance, and you could start sheltering $3 grand or $7 grand for a family in an HSA to build that 100 grand by retirement. So I'll stop sharing, and Rick, I'll let you comment. Go ahead. You want to unmute yourself, Rick, first? Should see the mute button on your Zoom controls around where you see stop video, participants.
Yeah, I don't see it. It doesn't show that it's on, but we can't hear you, Rick.
Yeah, Rick, let me go ahead. Rick, speak. I think you should be able to hear you now. No, you muted yourself just then. Rick, you want to test your voice? Can you say test, Rick? Yeah, we're not hearing you, Rick. Now you're muted. So do you want to comment, Roy, on the bill I showed, or on the sharing MEC HSA option that now is really growing fast and was featured by John Goodman and Forbes?
I mean, I'm in favor to giving as many people options as they can to, participate in the HSA. So I really don't have a whole lot more to say about it than that.
Okay, I'll start the questions. And folks, as you saw in chat, if you want to click the reactions tab around your Zoom controls, you'll see the icon to click raise hand. A couple of folks raised some questions in chat, and I'll get to them in a second. The struggle of the Medicare MSA option. Now, I know a lot of us say we need to allow the funding and use of HSAs for the seniors, but we also say Medicare MSAs have been around for a long time. How do you address that, the struggle of that Medicare option to get out there more in the market, and the inability for us to get more HSA use in the senior population? How do you respond to that?
Well, that option was actually created in 1997. And when I was at the Treasury Department in 2003, I asked CMS if they had ever offered any Medicare MSAs through the Medicare Advantage program, and nobody had ever gotten it off the ground. So, we spent the next year and a half, 2 years getting an Medicare MSA option available. And when it was available, I had both my parents and my in-laws enrolled in that option. They all loved it. The government puts money into your MSA, and you can use that to pay for your out-of-pocket expenses. It is money that you own. Unfortunately, you would not be able to contribute to it like you would an HSA, but it's, better than nothing, because today, those individuals on Medicare can't participate in an HSA. It was also created before Medicare Part D, so you can participate in a Medicare MSA plan and sign up for our prescription drug plan separately without creating any conflict. So I hear that Medicare MSAs are making a comeback. I think they were discouraged or not, certainly not encouraged during the Obama administration. So I'm not going to be surprised if they're not being encouraged currently. So, you know, we're trying to get that to change. And as more people age into the Medicare program, I think they're going to be asking the question, why can't I continue to participate in an HSA now that I'm 65? You know, you look at Part A, that's definitely a high deductible health plan. Their deductible is over $1,500 a year. And that's not even completely true. It's per admission to the hospital. So, you know, Medicare's got lots of cost sharing that, you know, is not covered any other way other than to purchase supplemental coverage or a Medicare Advantage plan. So the MSA option is a Medicare Advantage choice that people have, but it's not universally available, and I would definitely like to see that changed.
Fantastic. Before, John, you unmute yourself. Rick, do you want to test your voice again real quick?
Yeah, can you hear me?
Perfectly.
Yay.
Go ahead.
Took me a little while. The technology is a challenge for me. I can't help it. Roy, yeah, nice to see you again.
Good to see you too.
Remember the old HCC days with Scanlon
Yep.
and Dick Matthews and all those
Yep.
guys? Initiative that never really made it, but it was worth a shot. I had a couple of comments. It intrigued me during the presidential election in 2016 that Ben Carson had advocated $1,000 at birth in an HSA. And to me, that had a fantastic logic behind it. And that would be one thing that I would like to see resurrected. And, you know, if a 18-year-old had 18 years of $1,000 compounding, they could get very high deductible plans, and it would really drive down the cost of insurance. So that was one of those ideas that I really liked. And also with the progressives rulemakings, they've narrowed the gap between the HSA premiums and the benefits to almost nil between the high deductible plans. And I don't know if that was a poison pill. I don't know exactly why they did that. In the early days of HSAs, when you had worked on it and they were introduced, there was almost a 40% distance between the premium for an HSA compatible plan and the regular insurance plan. And that to me is one of the main reasons that the HSAs have not seen the growth path that we really wanted. And I was wondering if there is any will in Washington to kind of change some of those mandates that really have caused a lot of these the pricing for the premiums. And I don't know, have you been working with Bill West at all? I know he's been working with the ABA to try to get some of these things. I mean, MSAs, you know, I'll segue to another thing, and then I'll be quiet. I'm on Medicare Advantage plans, and in Connecticut, there isn't no Medicare savings plan available. So they're only in a few states in the country, and that's one of the challenges. I have to study for it, I have to understand it, but they are not available. As you know, every Medicare plan is available only with a county approval, basically.
Right.
So that is one of the challenges there. I would have been talking to Bill about just saying anyone that's on Medicare could have their own separate HSA, and that to me would be easier to enact than having insurance companies come up with their own MSA, and I'll
Yep.
be quiet at that point.
Yeah, no, we're trying very hard to get that done. It's really hard in the current environment, and if we do get anything done, it's probably going to be incremental. So we'll probably have to start with people who are currently working and are 65 and older. Nobody knew before HSAs came along that there were all these crazy rules about the interactions between Social Security and Medicare. And so, not only do I have to try to stay off of Medicare, but I also have to try to stay off of Social Security as well, because the minute I start accepting Social Security, I automatically get enrolled in Medicare Part A. And even if I wait, a year or so after I turn 65, they're going to retroactively enroll me in Part A for up to 6 months. I mean, did anybody know that those rules were here before HSAs came along? I certainly didn't. So, we've exposed those things and trying to get them changed, because some of them were done just by regulation and really don't have any basis in statute.
Interesting. Well, let's keep up the good fight there. I know that I'm still working, and I love to work, and I want to be productive as long as I can. And I'd love to have that above the line deduction for an HSA. I just think that they're a great program, and I lost it when I went on Medicare Advantage, and it's kind of sad.
Nope, I understand. I'm hopeful that we can get these changes by the time I am in on Medicare.
And Rick, your landing page is in chat. Do you have any comments on the role of HSAs with sharing for your small group market prospects and list
I
billing
can't
maybe?
say that many of them have even done it. Most of my clients are secure, but a lot of times they're driven to medical cost sharing by the sheer distance between the premiums. Fortunately, they're all healthy, and I have very few claims, but the HSA, I would say, has taken a back seat to the appeal of the medical cost sharing, just by the premiums and all the added features. And there's so many features on these plans, particularly through empowering benefits, that they have quite a bit of an appeal, but I can't say that there's an emphasis on HSAs with them, and there should be.
Yeah, we have a long way to go with the education. Thanks, Rick. John, you want to unmute yourself?
Sure. Thanks, Charlie. Roy, thanks for a very comprehensive talk on HSAs. I have one comment and then just one question. My comment is more around the other side of the equation that I'm particularly interested in myself and working on, and that's the cost side of the equation, which is also very important. Otherwise, we just keep chasing our tails, so to speak, and finding ways to pay for ever increasing cost of healthcare, but we just need to work on that cost side. So I think a really disruptive new delivery model is needed. I'm not talking about immediately trying to upend the status quo, because that is next to impossible, but just creating more of a parallel system that eventually gains enough momentum to eventually replace the status quo. So that's my one comment. My question is in regards to Medicare, because I am also approaching that age, or I'm now in my early 60s. And I don't know if either Roy or Charlie can comment on maybe how one, if and how one can fund and use the health matching account once you're hit the age of 65.
Well, I'll comment on that. The health matching account that doubles your money over 3 years for out-of-pockets. I put the link in chat. Take a look at it and contact me if you want more information. But whether you're saving up for an elective surgery with Dr. Taylor, that's what Dr. Taylor does, or any other out-of-pockets, like with HSA, you want to build up those funds so that you're not going bankrupt which happens a lot with people who even have insurance because the deductibles are so high. And it's not a problem to have a high deductible if you have an HSA or an HMA or these other accounts that Roy mentioned. HRAs is a bunch of them. But the point is to, protect yourself from the first dollar to that several thousandth dollar when the major medical kicks in, whether through insurance or sharing. John, does that answer your question?
Yeah, no, that's very good, because I bet a lot of people don't realize that they can't really use those HSAs once they're enrolled in Medicare the way that they could before. So I think that HMA provides another good alternative.
Yeah, the HMA is probably the best supplemental for a Medicare because it's a broader area for distributions for dental and all the electives, and you could double your money over 3 years. And by the way, here's my HSA mug from working with Greg Scanlon's group back in the mid 2000s. We're running out of time here, so Linda, what is your question? Go ahead and unmute yourself. Sorry, I muted you again by accident, Linda, when you unmuted yourself. There you go.
I don't understand much about financial issues, but I have two questions. How you evaluate or you consider the fact that health insurance companies like MedStar bought 10 hospitals in Maryland, and since our health services are terrible, very bad. And another question is, more and more we see the replacement of doctors with nurse practitioners and physician assistants, which is even worse. So, I mean, this is something I don't understand at all. It's terrible.
Roy, I might invite Dr. Wallen to unmute himself and address that, because that's a pet peeve of his as a cashier-ologist, is all the corporate takeovers of hospitals where they replace the doctors with the physician's assistants and nurses.
Exactly.
It's led to a lot of malpractice in the hospitals. And I think your first question has to do with the exclusion of the centers of excellence via the ever narrowing networks that insurers use to handcuff your choices. So, a lot of folks are getting sucked into Obamacare policies because of the premium subsidies, only to find out if they get cancer or heart attacks that the center of excellence that they want to go to is out of network. So surprise billing, hello. So that's why we're pretty high on sharing as a really effective alternative to insurance going forward for those who learn about it, because obviously a lot of the insurance folks don't want you to learn about sharing. Dr. Wallen, you want to comment?
Thank you, but still,
Yeah.
it's difficult time, difficult. I don't understand much.
Yeah, well, that's not really the scope of this conversation today, but Dr. Wallen.
I know, yes.
Yeah, I don't see Dr. Wallen responding, so I did. Roy, did you have a comment on the partner of HSA, the insurance companies, and what they're doing along with the corporatization of the hospitals?
Well, there's
Directly
there's certainly a lot of bigger dynamics at play in the healthcare delivery and financing system. Part of the reason for creating HSAs, remember that was done during the heyday of HMOs, was to give people choices and options to pay for their healthcare separately. I do understand that it's harder and harder sometimes to find willing healthcare providers because they have been acquired, if you will, by the larger healthcare players who are controlling some of those decisions. So I remain hopeful that there will still be ways to find physicians that will see you as a patient. I think that's frankly why more and more people are using direct primary care to ensure that they have that relationship with their primary physician. But on the specialty side, I don't think we have an equivalent of that model at this time.
We do. It's so small that you would think that direct specialty care is something we feature here and there. Dr. Wallen, can you comment on direct specialty care as well as the corporatization of healthcare, which is sicking patients with potentially unqualified nurses for severe episodes, as well as the foisting of networks that exclude the best doctors when you actually need them, which is with every insurance plan.
Yeah, absolutely. Thanks, Charles. I think from that standpoint, obviously, there's a lot of folks, a lot of business folks in general that run small businesses that kind of absolutely hate the corporate system in general. That certainly plays a role also for medicine in the fact that, certainly when you work for a corporate entity, which 70% of physicians overall are now employees, 85% actually, if you're under the age of 40 as a physician, are employees these days, which means you really can't be the best fiduciary for your patients because you're limited by what the choices are that are made by administrators, there's now 10-to-1 administrators for 2 physicians in the system. And so you have all this bureaucracy that prevents you from really truly doing the best for your patients. On top of that, as you alluded to, Charles, there truly is a push nowadays to replace physicians with folks that really just aren't qualified. They don't have the same training, they don't have the same education or experience as far as that goes. And just for comparison's sake, there's basically the shortest possible track to be a nurse practitioner in this day and age is an online course or degree, which takes 500 clinical hours compared to an independent practice physician, which is at minimum 15,000 hours of experience. So basically, you're talking about 3% of the actual experience and training. My quote to people always is, would you expect to compete and potentially win the Boston Marathon with about 3% of the training of the other folks that are competing? And I think most people realize that pretty quickly that they're really not going to have a chance. And so unfortunately, the one big thing in medicine is you really need to know your limitations and know what you don't know to try to get help when you need it. And unfortunately, if you don't do that, that's when folks get really hurt. And there's countless, examples of that throughout the country where folks have gotten hurt because someone didn't really realize what was going on, or they didn't realize what the limitations were. And I'm not saying physicians are perfect. We certainly make mistakes too. But, again, 15,000 hours of experience or even 20,000 hours of experience is a significant amount of time to try to prevent those types of things.
And Jerry, we're almost out of time. Real quick responses. The growth of direct specialty care.
Yeah, so direct specialty care, I think, is certainly an evolving market. Obviously, there's 3 centers in the country at least that are specifically all direct care or all direct surgical care, direct pay surgical care. That's in Texas Free Market Surgery. There's a new one that just opened up in Indiana, and then obviously the Surgery Center of Oklahoma, who's been the champion for a long time. Keith Smith and those guys really kind of made the template. And I think, obviously, as more and more folks are realizing that they're really truly paying so much in insurance or either premiums or deductibles or out of their pocket. Quite honestly, the average family of 4, the premiums are $22,000 a year. The deductible's another $8,400. So you're already talking about $30,000 out of your pocket before you actually get care. You can significantly change that by taking advantage of the cash market. And so that is certainly becoming a rapidly evolving thing. Obviously, the WOW Cash App and Mishi and some of these other online, connectors, if you will, to help patients find them are certainly out there that are developing as well. And that's certainly becoming a much better option for patients to get the highest quality care with experienced folks for the lowest market price that's out there.
And in Prime Benefits, we've beefed up our concierge service to help our HSA account holders shop for effective and well-priced tests, drugs, and specialists, because that's a big problem. People just are so cowed by the third-party dominance that they don't know where to go. So for those of us who are leaders in the cash empowerment revolution, we're learning as we go commercially how to make it work. Now, what about HSAs? This is HSA program, so we'll leave you, Jared, final comment on HSAs for patient empowerment. What do you think about that?
Oh, I mean, I love HSAs. I mean, I think the reality is, you see the self-directed medical logo here. We're having a free challenge to help people. One of the real things that I realized in the marketplace was that folks were just not, the general population doesn't understand how to take advantage of cash medical care, right? And so the HSA, I mean, I think from that standpoint, Roy kind of alluded to it, but I think it's most powerful as a triple tax-free retirement account. And using it, investing it tax-free, and growing that throughout your younger years to be able to use for whatever you want in retirement, and really kind of hanging on to that. Obviously, I think the HMA multiplier is great for out-of-pocket costs that can take the place of that. The HSA though is great to be able to kind of one of the things again that I kind of always go back to with patients when I'm talking to them about this stuff is that really remember, HSAs basically allow you to keep your money rather than giving it to the big insurance company who may or may not actually authorize your care when you actually need it, right? They're giving you quote unquote coverage, but that doesn't necessarily equal care. I mean, they have copays, premiums, co-insurance, deductibles, all these other claims education, all these other, there's probably a dozen or so different terms that they use for different ways that they manipulate and try to prevent or deny actually paying for your care when you actually need it. So, I think from that standpoint, the HSA is a great way to potentially start to shift some of that money back into patients' pockets, especially when 60% of the country has less than $1,000 in their bank account, right? So, obviously we need to be able to help the general population finance their care directly if we really want to truly grow this cash market, because no matter how many healers are out there, physicians or otherwise, if there's not patients that can take advantage of the market, then we really don't have a market, right? So there's two sides of that value exchange that need to come together to really grow this thing, and make it what it needs to be.
Roy, any comment on Dr. Wallen's comments, and you can wrap it up, how folks can reach you?
Yeah, no, I think that's the reality of where we are today. So I think, we're definitely getting more information about how people can save money by paying without insurance even. And whoever thought that was possible, that was one of the promises of HSAs, is to help drive costs down by people spending their own money and seeking best value. It's surprising me that, 20 years later, we're still talking about it as something we need to do rather than something that's already happening. The smartest people know how to do it, but obviously there's a lot of people who don't know that they can do it. So we still have a long way to go, unfortunately.
So what about your wealth? If your money could actually talk to you, would you listen to it? Well, with the DNA Network Academy, your money actually can talk to you. And it's going to tell you just what it told this client. This family had over 24 debts, mortgages, car loans, the works. They were on track to take 20 years to pay it all off, and instead did it in 8.5. Plus, they did it without refinancing, making more money, or even changing their lifestyle. So find out for yourself with a free analysis that is completely confidential. No personal information, no social security numbers, no credit checks, none of that nonsense. But what is exciting is that the outcome of that report you receive is a guaranteed outcome for you. To get that report, head on over to bit.ly/debt2wealth. You will arrive at this simple form. Fill it in, as simple as lender number 1 and credit card number 2. What really matters is the accuracy of your numbers. You'll be able to see that if instead of 20 years or whatever your number is, that you may actually be out of debt and on your way to wealth in as little as 6.3 years like this client.